Hello, I'm Nancy van der Pooij. I'm the Doctor of Clinical Psychology. I work here in critical care, and I'm going to show you how to do the CAM ICU. Just to remind you, that stands for Confusion Assessment Method, and it's the most validated way that we have of testing to see whether or not somebody is delirious. And it tests for the two key symptoms that need to be there for delirium, which are inattention and disorganized thinking. So the test is in two parts. You could do this test with any patient. They can be ventilated or not. The main thing is that they are alert to an external stimulus, that when you say their name, for example, they can open their eyes and that they can keep their eyes open. If they can do that, you can test for delirium. So my colleague Kezia is acting as the patient. Let's do it. Hi Kezia. I'm just going to give you a little test to see if your brain is lively or if it's tired this morning. Is that okay? Right. So I'm going to take your hand. Can you give me a hand? Great. I want you to squeeze it and then relax. Great, thank you. So I'm now going to ask you to squeeze my hand every time I say the letter A. So I want you to squeeze my hand every time I say the letter A. Is that okay? All right. S, A, V, E, A, H, A, R, T. Thank you. That's the first part of the test, and you're testing therefore inattention. Are they able to attend to a 10 letter sequence and squeeze appropriately? They're allowed to make 2 mistakes. They're allowed to, if they squeeze on an A when you haven't said an A, that's a mistake. If they don't squeeze when you have said an A, that's a mistake. If they keep squeezing, if they don't squeeze at all, those are all mistakes. And if they make more than 2 mistakes, you need to go on to the second part. But if they make less than 2 mistakes, you can stop there, because it means they can attend. And for it to be delirium, they have to have inattention and disorganized thinking. So we're going to presume that in this instance, Kezia made more than 2 mistakes. So you then move on to the next part of the test, which is testing for disorganized thinking. There you ask 4 questions. They just have to nod or shake their head. The wording is quite particular, so I like to have a sheet with the questions written on. You might have a better memory than me and can do it without after a while. Kezia, I'm now just going to ask you 4 questions. And I just want you to answer yes or no, or just nod or shake yes or no. Question number 1, will a stone float on water? Are there fish in the sea? Does 1 pound weigh more than 2 pounds? Can you use a hammer to pound a nail? Great. And then I'm going to ask you to, can you do the same? Can you show me 2 fingers? And can you do the same but with the other hand? Brilliant, thank you. That's the test. In the second half, the patient is allowed to make 1 mistake. And if they make more than 1 mistake, then it means they've got disorganized thinking. And if they fail both of those, then you're likely that you're dealing with someone who is delirious. You put it up on the chart that they were CAM positive, which means that they were delirious, and then you can follow the pathways that are in the resource folder that give you some advice about what to do if someone is delirious, or what to do if somebody is not delirious but you're a bit worried about them. That's a very quick snapshot of a CAM ICU. There's a lot more to it if you wanted more in-depth information. We've got 2 key people across the sites who are doing a lot around CAM. One of them is Lucy O'Byrne in Basingstoke, and the other is Rachel Newell in Winchester, and you can go to them about CAM ICU if you need to know more. This is a quick snapshot. Just a PS, which I forgot to say before. This crib sheet on the questions and also the sort of spelling out of the letters is in your resource folder, along with other information. So you can, and that's by each bedside, so you can get more information there.